China's doing all of this spying kinds of things. It really has nothing to do with the kids.
These friends of mine so they can find you. Can't make your thing. A lot of people can't make this, so I.
Well, they can do it through Zoom.
And I can't make this time, so but I'm gonna send them to your YouTube.
She can change. I don't know if they can change the time. That's through them. It's not through me.
No, I'm just saying.
Surely, did you try?
They give
I have trouble with
your
these too
card,
sometimes.
And they can find you on
At home, I
YouTube.
have that.
In fact, there's a couple that
Maybe
missed
the
last
person
week.
Yeah.
They
young
they
person.
were confused. They didn't know you were up here. They thought you were down. So I'm gonna send them to your
Oh, that would
YouTube.
be good. Thank you.
Oh, sure.
I appreciate that.
Sorry.
At least it's just water. No problem.
Tell me when you want to start. Just 1 minute left.
Oh, yeah, that was. Wait a second.
Mark, can you hear us okay on there?
Sign your thing here. I'll bring it to you. Here's a pen.
I can hear you. Thank you.
Thank you.
Every time I'm here.
Oh, so just hit the.
Wait, or to go to the next slide. If you need to go back. you can go
Okay.
back. Probably you shouldn't have to hit anything else.
Do you want this? Sure, thanks. Oh, that's fine.
Good, how are you?
Okay.
Right, does it go to the next one?
Sorry.
I'm gonna test going to the next
I'm
slide.
gonna come over to the side.
Okay. Let me just make sure it's still working. Okay. Yep. Are good to get started.
Good morning, everybody.
Good morning.
My name is Jeff Weinberg, and this is the third series, actually it's the fourth, of a series that I've been doing in terms of issues with aging. And some of it is based on my book, which is called The Emperor Needs New Clothes, or Why Caring Has Disappeared from Healthcare.
I like the emperor needs new clothes.
Yeah. I think that was written before.
Right. Give me a child's book, right?
But in any case, what we've been talking about is trying to prepare ourselves for issues that may occur, and what you need to, in terms of documents and things like that, so that God forbid something happens to you, you are able to have a family member or somebody step in and help with whatever process is going on at the time. So that's kind of what we've been talking about right now. Today is an important discussion because people really, they have health insurance, but they don't necessarily know what health insurance covers or doesn't cover. And so that's what we're going to go over today. Just before we get started on today, there's a couple things that I wanted to tie up as loose ends. Last week, we talked about documents that you should have and talked about having a advance directive or living will. And those are the same, by the way, but the advance directive and living will talk about in the event something happens to you, what kind of things do you want for yourself? And usually you provide someone who's either, it could be the same or it could be different, a medical power of attorney, as well as a financial power of attorney. And the living will spells out what you want. So for example, you know, if you are unconscious, do you want to be resuscitated? Do you want advanced supports like being on a ventilator? Things like that. And it's Sue, right?
Yes.
Okay. She just pointed out, which I really forgot, I was saying it casually. I have a YouTube channel called Caregiver Champion under YouTube. And the programs that I've been doing here, as well as other programs that I've done in the past, are on that channel. So if you missed one of the things that are on my in one of my courses or lectures, you can get it under
Caregiver Champion.
Caregiver Champion and look up YouTube.
Thank you.
Yeah. Also, just a little, I do have a website as well. And the website, and I have some brochures that have it too, is caregiverchampionadvocate.com. Because I am a nationally certified healthcare patient advocate. So,
.com, you said?
sorry?
.com?
Yes. Caregiverchampionadvocate.com. So to finish up the last several things that we've been talking about, I mentioned this last week. This is called a POLST form. POLST. I'll pass it around. It's pink, so that makes it so that people can see this. But in essence, this is a doctor's order sheet. So if you, I have a client right now who's in a personal care home, okay? And they asked, if you needed to be resuscitated, what do you want to have happen? Well, he can say, yes, I want to be resuscitated, or no, I don't. But in reality, unless he has a doctor's order, then the paramedics or whoever's available are going to resuscitate that person.
So they resuscitate automatically. There's nothing-
Automatically.
There's nothing that says not
Exactly.
to.
Soon, and especially if you call the paramedics or, they're gonna do everything, all measures possible. It's gonna go to the emergency room or whatever. Yes, ma'am.
So where do you keep this? Do you keep this at home to take
So
with
this,
you? Yeah.
this, you, I tell people to put it on the refrigerator.
You can put it on your refrigerator in case you're home, but in case you're out, if you take a picture of this and put it on your phone under your name or something like
Yeah, but
that.
then the people have to know to look for it.
Yeah, but I
You
mean,
might
that's
not
the
be.
best thing to have. And then if you're able to tell them, or if a person of your family comes, at least they know if they can't go through the papers right away, it's right on your phone.
Well, good. I mean, that's a very good idea. Thank
Under
you.
your name and then maybe have
Right.
subheading resuscitate or not, whatever you want to call it.
But what this does is take your advanced directives or living will and it condenses it so that this becomes a doctor's order. And then when someone sees this, they know exactly what they should do or shouldn't do.
Does this need to be notarized or anything?
No, no, it just needs to be signed by the doctor.
Where do you get that pink sheet?
It's from the Pennsylvania.
Department of Health.
It's on there, right?
Yeah, Pennsylvania Department of Health.
Right. Okay, so that's that. And then this was an interesting document. Well, it's not a document, but it was in the Sunday New York Times last week. And it talked about a sort of a checklist, but what to do to prepare for dying. Did you see this?
No, I didn't see it, but it's
Oh.
something that I keep thinking about and I keep probably processing my paperwork or things that I need to. so
Well,
that-
make sure you see the one that I did last week on the 25 documents.
25.
Yeah, that'll be on YouTube. So, but anyhow, this was like right after we did this. So it says, are you prepared to die? Well, you're not, there's usually prepared to die,
Excuse me,
but mentally you need to start thinking about that.
exactly.
And you need to have discussions with your family about that.
Mhm.
Okay, so the first question is, have you thought about what you want to happen to your body? The next question is, have you thought about what you want to happen to your possessions? And so it just goes through a thought process that I think is really very helpful.
Mhm.
But this was in the New York Times last Sunday, which was March 17th. I'm sure you can look it up. Okay. So we are going to move on. Anything else anybody wants to bring up before we get started? Okay. So this book is a wonderful book. It is the complete elder care planner. I could pass this around to you.
Elder Care planner.
Author of Who Will Take Care of Me When I'm Old?
Mhm. And
Well, I know my kids won't, so I better take care of myself.
exactly,
Could you say the title again?
elder care planner.
And I can pass this around too. But
Where
it
did I
has
get-
almost
Where
every
can I
aspect.
get that book? Well, I
You
guess
can
in
get
Barnes
it
and
at
Noble.
Barnes and Noble or Amazon. And it's $23.
You have to hurry up because
If you
it's a
live in
pretty,
Canada, it's $30.
it's a pretty thick book, so you have to hurry up and read it.
No, actually, it's large print, which is good. And the chapters are very easy to read.
Excellent.
Okay. So we're gonna get started.
Can I see the paper, newspaper?
Yeah.
Department of Health.
This is true. To understand how the caring disappeared from healthcare, follow the money. So a little bit of history about health insurance. As you can see, in the 1600s, there was the concept of almshouses, which were really houses for the poor. But that's where people went when they were sick too. What then happened there was what was called in 1940 the Hill-Burton Act, which changed the focus of facilities of housing older Americans to the concept of medical care. And now, going back a step, the almshouses were homes for the poor, but religious institutions started their own care facility. And so, but it was basically, in terms of medical care, it was just, again, another way to help people who didn't have anybody else to help them. The Hill-Burton Act, which was in 1940, was the beginning of people starting to think, well, there's more to this than just housing. So the Social Security Act was signed by FDR in 1935. Well, unfortunately for the people living then, when people retired, they absolutely had no income. So your family either took care of you, or you might have gotten a small pension from where you worked. But basically you had no income. The other thing going on in the 30s was the depression. So because
Struggling.
yeah, so people were struggling financially anyhow. So with Social Security, two things occurred. One was that when someone was 65 or older, they would be eligible for some form of income based on the work credits that they got when they were enrolled. And the second thing is, for people who were disabled, they also are able to get Social Security, no matter what the age is. So that was the beginning of, again, helping people when they get older from a financial perspective. And the next big act, so you look at this, it's like 30 years later, in 1995, Medicare and Medicaid were established. And there was called Title 18 and Title 19. So again, if you had Social Security, you now were eligible for Medicare. And that again was whether you were 65 and older or whether you were disabled. And Title 19 is for Medicaid. And that's for people who have low income, usually on poverty level, and can't afford health care. So we covered this very quickly before, so I'm just going to go over it real quick. So when Medicare started, hospitals and places like that got what was called retrospective reimbursement, which meant that it was a cost to charge ratio. So for example, you have a pretty sweater on and you might have bought it at Macy's for $40. I don't know. So, but meanwhile, that sweater was made in Korea or somewhere, and it costs less than $4 to make. Okay. And then they sell it to a distributor, and the distributor pays $14 for that sweater. And then the distributor sells it to Macy's, and Macy's pays $20 for that sweater. And I'm making these numbers up.
Yeah.
But the idea is you buy that sweater at $40 and it was $80 on sale, half off. So now you're going, look at this, I got a sweater for $40, which is what my wife says to me all the time. And I say to her, oh, that's nice. It's like, I'm not gonna give you that there. So what happened at this particular point is that, and some of you probably can remember this, that essentially an aspirin, which would cost 10 cents, when you're in the hospital costs $10. And part of that was that the aspirin had to be taken and put into a bottle. It had to be labeled, and the pharmacist is doing this. Then the aspirin has to be taken up to the nurse's station, and somebody is getting paid to do that. And then they get to the nurse, and the nurse has to dispense the aspirin. And so that in turn is where you end up with a 10 cents aspirin
For $10.
for
yeah.
$10. The other thing is that Medicare paid hospitals for being in the hospital.
Mhm.
And I think we'll go to the next one. So, for example, let me just see something here. For example, when my mother had a heart attack, she was in the hospital for 3 months. I ran a facility, a subacute care facility, where people had heart surgery, and on the 5th day, there were 4 nights in the hospital. On the 5th day, they came to my facility. So what was the difference? Well, the difference was hospitals weren't getting paid the same way. So the reimbursement changed from retroactive to prospective reimbursement. And what occurred is DRGs, and this is how hospitals get paid today, okay? And DRGs are diagnostic related groupings. So for example, going back to the heart attack, the DRG for that heart attack now is 4 nights. If the hospital keeps that person 5 nights, or and let's just say for 4 nights, the hospital gets paid $200,000. So it's like $50,000 a day. So if they stay 5 nights, they still only get paid $200,000. If they stay 6 nights, they still only get paid $200,000. If they get out in 3 nights, then they still get paid $200,000. So one of the things that people, if they understand this, realize is the hospital wants to get you discharged as quickly as possible, which is totally the opposite of the way it was before. Okay. I just talked about that. So now we're going to get to Medicare. And this is, people will go, well, I have Medicare and it covers everything. You're right, you're shaking your head no. But a lot of people, not just a few people, don't understand that Medicare does not cover everything. And in some instances, they may not cover anything that you're thinking about wanting it to be covered. So Medicare is broken down into these 4 categories. Medicare Part A. And Part A is inpatient care. So when you're in the hospital or you're in a skilled nursing facility, Part A covers your Medicare. Now, if you're in a skilled nursing facility, the payment changes a little bit. So you can be covered in a skilled nursing facility for 20 days in full. And then in day 21 to day 100, you only get covered for 80%. And like you have to be responsible for the copay, which is now about $195 a day. So, and usually, I mean, people explain this to you, but once again, you go into a skilled nursing facility, well, thinking, I need rehab and it will take me 3 weeks or whatever. Well, the first 20 days is okay. But then after that, you're paying $195 a day to be there. So this is part of this, Medicare covers everything thinking. So the next part is called Part B Medicare. And Part B Medicare is all of your outpatient services. Part C Medicare, yes.
What is DME?
DME,
Yeah.
medical equipment.
Oh,
Part C Medicare is what's now called the Medicare Advantage Plans. And what they have done is they have grouped Part A, Part B, and Part D, which is prescription drugs, into one system. However, and this is where, we talk about this a little bit more, you go, well, I have UPMC for you, okay? And you go, oh, I'm covered with everything now. However, you can only go you're restricted to where you go to. You can only go to UPMC facilities. you want to go to an Allegheny General facility, they don't play well in the sandbox together. Okay. The same with doctors. Some physicians will take a UPMC and other people will take Allegheny Health. Prescriptions pretty much are covered. And for those plans, you can play, like I have an Aetna plan. And my Aetna plan, I pay for myself and my wife about $30 a month. It's like $15 a month. It's called the Aetna Gold Plan. Except it ain't as gold as you think it is. But in any case, you need to know that if you're taking a Medicare Advantage plan, it's only covered for the places that will take that plan for services. So for example, now Medicare is covered anywhere in the country. No matter where you're at, Medicare is going to cover those 3 areas. Usually, if you don't have Medicare Advantage plan, then you pay for what's called a supplemental insurance plan. And that's through AARP or some other places that will supplement your insurance so that whatever Medicare doesn't pay, the supplemental insurance will pay. So there's a lot of people, especially at Squirrel Hill, they're snowbirds, they go to Florida. Well, a lot of them don't think about the fact that their health insurance may not cover them in Florida.
Why would it not cover them in Florida?
Because they're on a Medicare Advantage plan and they have to go to a UPMC facility. Now they'll cover them for the emergency room, but they won't cover for extended care. So again, if you're thinking of traveling for an extensive amount of time, you might want to look at what is your health insurance cover and what doesn't it cover? And then how do I get coverage for what it doesn't cover? Okay. I mean, we went to, my kids lived in England for 3 years and we went to London for, I don't know, 2 months. And essentially didn't have coverage. So any questions about Medicare? I mean, that really is the most prevalent and the most important thing, to know what it covers and what it doesn't cover. Now, the Medicare Advantage plans, which is the Part C, they also cover hearing aids, dental, some other kinds of services. However, once again, you can only go to participating doctors. So I needed hearing aids, which I'm not using today. And I called Aetna and they said, well, if you want, you know, there's a place in Squirrel Hill that you can buy, okay? So I go to this place and I'm like, I'm looking and I'm looking and I'm looking. And it's not like on the main street here. And I'm going, where is this place? And here it's in someone's house in the basement. Not that
It's odd.
it is odd, isn't it? And she says, you can get this hearing aid, this hearing aid, and this hearing aid, none of which were hearing aids that you could charge automatically. You needed to put a battery in, this kind of thing. So I went to Costco and bought them myself. So again, it's the same with dental work. You know, usually in terms of dental work, if you're on a Medicare Advantage plan, they'll pay for a dental visit twice a year, which is what you're supposed to have. And that's usually a cleaning and whatever else. But if you need fillings or you need other kinds of work, they may or may not pay for that. Now, Medicare doesn't pay for any of this unless it's in an emergent situation and it's under quote unquote surgery. So as people age, obviously, people need more specific kinds of services and care. I don't know if this is when I get on my Medicare high horse, but I'm sure all of you are aware that Medicare for many politicians isn't important. And in fact, they want to cut it. And they want to cut Social Security. Well, everybody that has worked has earned, you're paying a portion of your salary to Social Security, which gets tied into Medicare. So every person that's worked, irregardless, has paid for this. So it's not like it's free. But what's happened, of course, is that, you know, my population, which is the baby boomers, you know, we had 10,000 people a day turning 65. And I think it's still going on. We're kind of at the tail end of that. But there's a lot of people that hit that Medicare rule pretty quickly. And now they're talking about raising the age of Medicare and Social Security to 68, 69, 70. Which is, it's not fine. I was gonna say it's all good, but it's not. Because a lot of people can't continue to work. They need health insurance coverage. And they don't get it. The other piece to this is that, as we said, Medicare doesn't always cover everything. It just covers, you know, your basic necessities. So then we get to medical assistance or Medicaid. And once again, we're talking about people who, now they may have Medicare, but like when we talk about what else needs to be paid for, like the 21 to 100 days, Medicaid then comes in and pays for the supplement. Some, you know, even though the copay for Part B may be a $30 charge to see a doctor, which it usually is, people can't afford that. So Medicaid will help people pay for those kind of doctor visits.
But in order to have Medicaid, you have to have a certain, like below the.
Below, usually at poverty level
Yeah.
or below. Yes.
Well, and it also depends on whether the state will accept Medicaid. I mean, there are a number of states that have not funded a Medicaid.
Oh,
program.
exactly.
Oh, really? I didn't know
Yeah.
that.
We're talking about,
How good states to live in.
we're talking about the state of Pennsylvania.
Yeah, but I just.
But again, now that same doctor that you're paying $30 to for your co-insurance payment, they don't have to accept Medicaid.
You're right.
So you're correct in what you started to say about certain states don't even have it. Because Medicaid is really a state operated. They get Medicare funding, but the Medicaid part of it
It's the state.
is state. So the Department of Welfare is where you're eligible for Medicaid or not eligible.
Or I think disabled people get Medicaid.
They can if they're not eligible for Social Security and they can't work.
Yeah, if they're not working, right.
But the other part of that even is like, if you're single and there's an ounce of ability to work, you won't get it. You will not get Medicaid. So Medicaid does help people, but they're at poverty level. But again, the amount of services available become more
Less.
limited. Okay. And there is a disproportion of people that are on Medicare as opposed to people on Medicaid in terms of their health status in general.
I'm just wondering now, if you get Medicaid, you cannot get Medicare?
No, you automatically get Medicare as long as you've worked and you can get Social Security. Or if you're disabled and you haven't worked for 2 years, you can get Medicare.
Okay. No, I'm thinking of somebody that has had a illness and was not capable of working.
Well, then they would be eligible for Medicare after 2 years of not working.
Okay, Medicare
They
and
would
Medicaid.
get Social Security
And Social-
disability,
Yeah.
okay?
Could you go back to the financial differential between people on Medicare? You started to say there's a financial differential between the two populations.
Well, in order to be eligible for Medicaid, you
You have to
need,
be poverty level.
you have to be at poverty level. Now,
What is poverty level?
right now, I'm gonna say, and this is a guesstimate, but it's
Yeah.
close. Like, a single person is maybe $8,000 to $10,000 a year. A family or a husband and wife is kind of like $12,000 to $14,000 a year.
If you're disabled, you have to be at the poverty level too.
Sorry?
If you're disabled, you have to be at the
No,
poverty
if
level.
you're disabled, you're eligible for Social Security disability and Medicare. But your eligibility is actually, you have to wait 2 years to get it.
It's all based on your income, your prior income or your current income.
If you're disabled, no, it's not based on your income. But Medicaid is. Now, and I'm gonna get into this in a minute, but I'll start here. So the cost of being in a nursing home outside of what skilled nursing paid for is approximately $15,000 to $20,000 a month. Ooh. All right. So not many people have $200,000 even for like a year's worth of nursing home care. But if they still need to be in a nursing home, then what happens is they qualify for Medicaid,
Medicaid, okay.
okay? Because now they've spent all their money, or most of their money. However, there is what's called a 5-year look back. So if I go into a nursing home and I can't return, I have to spend my $200,000 to get eligible. But let's just say I had another $200,000 in an IRA or in some kind of a savings account. And I gave that money to my children. If I didn't give it to them in the past,
Before you went.
before I went, if I didn't give it to them 5 years before, I'm going to be penalized before I go on Medicaid. And this is where I talk to people about, you really need to, if you have an estate that you want to be protected or things like that, you need to set up and talk to an estate attorney, an elder law estate attorney. Because you're not going to get Medicaid until you can justify what happened to the money before that. And almost everybody is not aware of this.
You're better off to have given the money to your children before you've even
Right.
reached a retirement age.
Right.
You just have to know that.
And including your house, your car, or whatever. So, but once again, there are ways that you can keep your money, but you have to set up a trust or you have to do something else. And then the elder law attorney has worked out like whatever your penalty would be by having the money and stuff like that. But the key to remember is that it's one thing to go into the skilled nursing facility because you need rehabilitation, but it's another thing to go there and have to stay there. Okay, so let's take the next step. So the next step is called personal care. I'll finish with this, but I want, while I'm on the nursing home part.
Personal care.
Personal care or assisted living. So for example, Weinberg Terrace, which is right here in Squirrel Hill, it costs $8,000 to $9,000 a month. So it's not 15 to 20, but it ain't chump change either.
Mhm.
So $8,000 a month times 12 is close to $100,000. No insurance pays for this. It has to come from private pay. Medicaid,
No insurance covers.
no insurance
Assisted
covers the
living.
stay in personal care or assisted living.
Are they the same personal? care?
Sorry?
Are they the same personal care?
Yeah. There's a little bit of a twist in whether you get more care or less care, but they're still the same.
About the same price?
Yes. Well, no, so I'm talking about the top of the line.
Depends upon the facility. that
Yeah,
you-
I mean, you could pay $4,000 or $5,000 a month and you would be sharing a room and, whatever. So there are facilities that you can pay less money for, But all of that money is coming from private pay. Now, the one thing that, if you have long-term care insurance, it will,
Which you have to have gotten just before you retired, otherwise you can't get it. So
it's,
before
well, you can get
retire,
it, but you can pay $1 million
it's paid
bucks
much
for it.
more, yes.
Right.
You have to consider these things before you retire.
And see, that goes back to what we said about, are you prepared to die? Well, no, you're not prepared to die, but are you thinking
Are you
about what
prepared to
might,
live?
yeah, are you prepared to live and how are you gonna cover yourself? Okay? So it's not easy. And so if you have long-term care insurance, the long-term care insurance will pay for personal care.
But
But
then you're
that's a
paying for
private, that's a private insurance.
and that you're starting to pay for when you retire, so that it's depending upon how long you
Less
live.
expensive
Yeah,
and will give you some kind of good coverage. Exactly. I actually, well, I was working in healthcare. So I was able to get long-term care insurance when I was like, I don't know, 50, 55. And I just got it. The other thing about long-term care insurance is it's age-related, but it's also health-related. So if you have health issues, you're not going to get coverage.
but that's when you, like when you're 65 and you're starting to take it, you have to be in good health at that time. You could get a little ill later on.
Oh, yeah, you
but
can
you're
get it,
already
but
covered.
when you start to enable it, that's what happens, okay? So personal care is not covered at all unless you have long-term care insurance. So the next level of care, and what I'm doing is taking you through levels of care here, is called home care. Home care is also not covered by any insurance at all. And home care nowadays is costing people about $30 an hour. If they're in an agency, they want at least 4-hour minimum a day. So if you had $30 an hour and you needed 8 hours of care that day, $240 a day times 7 is $1,500 a week. Times 4, you're up to personal care levels. My mother-in-law had about $200,000 in income. And, she didn't want to go anywhere but be in her apartment. So we literally, and she needed 24-hour care. So her $200,000 was spent in
Very quickly.
about 1 year. And again, people need to think about this. What's going to happen if I need this? Yeah, I mean, you can rely on your family, but that gets tired from another perspective. So home care is not paid for as well. Now, again, if you have long-term care insurance, it's paid for after what they call a waiting period. So it's usually 30 or 60 days. The other type of services or care are called home health care. And home health care is paid for under skilled nursing because now you have a registered nurse or PT physical therapy and occupational therapy. But they only come 2 to 3 times a week. They only are there for about an hour at a time. And then as soon as they think you're better, they're done.
Who is this paid by? Is this? paid
Home
by-
health care is paid for by your Medicare, under
by
skilled
Medicare?
nursing. And as soon as you're able to get out of the house, you're done. You then have to get an outpatient care somewhere. So this is important to make sure you understand, because it is crucial to people that they understand this so that they know that certain things will be covered and certain things will not be covered. And what do I do as an alternative?
This is the kind of talk that needs to be had with people who are just beginning to think about leaving their jobs, turning 65. So this is all that information they need to have
Exactly.
so that they can make those decisions at that time when you can make them, when you still have the money to make them.
And I have done a talk similar for people who are retiring,
Mhm.
and it's called How to Prepare for Retirement.
That's right.
But if
And
you
that's
know,
where the
if
information is good.
any of you know places where they could benefit from what I'm telling them
Mhm.
or telling you, feel free to contact me and I'll call and follow up with it or whatever. But once again, like Sue said, this will be on my YouTube channel.
Mhm. Well, now people go on YouTube, but when I was retiring, we didn't
Right.
have that.
Exactly. I didn't either.
But I was very fortunate where I worked, they had people come in and discuss this before we retired.
Where'd you work?
I worked up in Alaska.
Okay. Warp coded.
Yeah.
Okay. Anyhow,
No, I
So-
also, yeah, I also ended up with Alaska Care and they use Aetna as well.
okay.
So that was, they covered me 100%. But then when I retired at 65, when Medicare came in, then they only covered me 80%, but then my insurance covered the other 20%. But I
And
was
see,
better
people
off without
have to-
Medicare.
But people have to know this and they have to understand it.
So I was fortunate that
Because
they.
there's so many
explained it.
people that like, yippee, I don't have to work anymore.
No, you have to understand what the responsibilities are.
Absolutely. And the other piece of this is that part of my How to Prepare for Retirement, the name of that topic for me is Retirement Isn't Eating Lunch with Your Wife every day.
Retirement
or
isn't
drink-
cheap.
Or drinking beer on the porch every day.
Aetna Gold. What is that?
Sorry?
The Aetna Gold, what is that?
Aetna Gold, it's just a product that they have under the managed care. You pay a certain amount of money and it gives you more coverage. Like I got the hearing aid coverage and you saw how good that was. Well, the other part may not have the
Does
hearing.
that include, is there co-pays with that or anything?
Excuse
Is
me,
there co-pays with that?
there's no copay.
And then,
Well, there is, if I go to the doctor, I have to pay $30 instead of $300.
does it include travel, like if you're in other parts of the world?
If you travel and you're there only for emergencies, it'll cover. But
You always
unless,
have to let your insurance company know when you're traveling, where you're going, how long you're gonna be out. So if you give them that information, then should anything happen to you, they're already prepared.
that is such a good point.
So is
Next time I do this talk, you're coming with me.
Gold, was that like, something that they discontinued because it was, there was one plan where you didn't have to do anything, pay anything, you don't get billed, but you have to pay a certain amount every month, like a little bit high, you have to start out paying a higher amount every month.
You have to know that. Now, the other thing, and then we're gonna move on, is that all of these advantage plans and products, you need to find somebody who is an independent insurance agent. So UPMC advertises all the time, we've got the plan for you. Well, they've got the plan, but it may not be specifically for you. So you need to be able to find an independent insurance agent, and there's plenty of them out there, so that they can look at your total picture, including like what medicines are you on. Because once again, your medicines may be your highest cost of care and you don't have any coverage. So you need to have somebody look at that whole picture. All right, any,
Where I got
And I believe it's because now they track you more carefully.
Oh, maybe they're tracking me. Yeah, there
Yeah.
could be. I never had
I
that
was surprised.
situation.
I mean, I think I did this like last.
I even do that
February.
with my bank account. I always let important people know where I'm going and
Yeah.
the fact that I'm going out for how long.
I hadn't thought about letting my insurance know, but I was surprised when I got that message from the credit card.
I guess I learned that when I was a little kid. My
Your
mother
regular
worked. So
it doesn't cover travel.
wherever you go, leave me a note. We used to write notes.
Only
at the time.
emergency.
Always let me know where you're going. So when I come home and you're not there, I know where you
Yeah.
are and it doesn't get me upset. So
Well,
there's
it
a
used-
lesson that
it
you
used to really
learn.
be.
all right, real quick, because we want to finish up
Yeah.
here. So, but those things that I just covered is really critical.
Mhm.
And those are the things that are most important. So the other areas is the CHIP program, which is for children under the age of 19. And that's a children's health insurance program. And I'm stuck. And what's called Obamacare.
Oh, that's something new.
No, it's not new. It was passed when President Obama was in office. Because there was anywhere between 36 and 40 million people in the population
Thing there.
that fell into what I would call that kind of crack. It So the issues were that there was no coverage. They weren't eligible for Medicare. They weren't eligible for Medicaid. They may have been working and their income was in between poverty and the next level. So they absolutely had no coverage. So Obamacare, which again is a very political minefield, covers 40 million people that needed health insurance.
So I'm concerned by the bill that was passed by the House Budget Committee. Does that make those more
Well,
vulnerable?
this is where we get into trouble. And this is where, as being your advocate, being your own advocate, you need to pay attention to this stuff. You need to write your congressman and senator and say, hey, I hope you're not in favor of this because I'm not going to vote for you next time.
Can you go back one so we get to the Obamacare one or not?
I don't have it on there, I don't think.
They're finding out.
Here's one of the soup ones.
Okay.
Go ahead.
Oh, wait, just, can you just leave that there for 1 second?
It's Patient Protection and Affordable Care Act, it's Obamacare.
CM, did you have a question?
Yes, I want to find out why a doctor, MD or DO cannot register in all 50 states in this country.
I missed the question.
Can you repeat that, please?
Why a MD doctor or a DO doctor cannot be registered to care for his patients in all 50 states in USA. I came to Pennsylvania from California and my doctor could not provide me medicines for 6 months
Why?
because our doctors are registered in one state only.
Are you on a specialized medicine?
Yes, cardiology, I have had bypass surgery, CABG, 4 arteries, 80% blocked.
Okay, if you're on a specialized medicine, sometimes you can write to the manufacturer and they will get you the medicine either at a very reduced rate or free. So
Can you take up this matter because you are a big person? Why can't a doctor practice in more than one state? Can a doctor practice in 10, 20 or 40 states?
they're not supposed to.
In other countries, when I was working in Europe, I had no problems.
Well, because the healthcare coverage is different. Now you're talking about universal healthcare and socialized medicine. It's much different. Now, interestingly enough, Florida passed a bill that people can buy their prescriptions in Canada. So, but you're technically, like, if I go to Florida on vacation and I run out of like blood pressure medicine, I can't walk into a pharmacy in Florida and say, I have this blood pressure medicine, call my doctor and get it renewed. I can call the pharmacy in Pittsburgh and get it renewed. So I would say, sir, that you either need to write to your manufacturer and see how you can get this medicine. Okay?
Can I ask a
Okay.
question? I have Silver Script. It's cheaper for me to go to Costco with and not use it, get my medication. So why should I keep paying Silver Script if they're more expensive than?
You don't have to. Now,
Cancel it?
there is what's called RX Plus, which is a free service. And RX Plus is a discounted service that the pharmacies can offer to you.
So okay,
Again, you don't know about.
so if you drop your Silver Script, can you pick it up later? Or
Yeah,
you won't get penalized?
no. Now, is that part of a bigger plan or is that just?
Well, I have supplemental insurance, and then I have Silver Script.
Separately, Silver Script. Yeah, if you don't need to pay for it, then you don't need to pay for it. Okay, real quick, before we're getting antsy,
Gotta be, yeah, gotta be somewhere.
President Biden did a wonderful thing with sole business with insulin. People were paying, and insulin cost about 30 cents to make, and they were charging well over $300 for coverage. And then this talks about how I can help as an advocate and basically helping you understand these insurances, reviewing your bills, making sure that you're not paid for something that you don't need. And then this is resources that you can contact. And that's it.
Can you go back one?
So thank you for coming.
Thank you,
That's your card.
very helpful.
And I do offer the first call as a free consultation service. So if you have questions, feel free to call me. Again, check out the YouTube channel.
Will this be on your website? I don't have my camera with me and I'd like to keep track of these.
Oops, here.
Oh, I'm sorry. Yeah, I'll just take it from you. Thank you. Okay,
There it is.
Yeah.
There's my
The
website.
emperor needs new clothes. I like that. Thank you.
Thank you for
very much.
coming.
Yeah, yeah, yeah.
Thank you, Liz.
Huh? You're welcome. Thank you. Thank you, Mark online. We're gonna end the Zoom. Thanks for coming.
Can you go back one more? Can you go back one?
Is that gentleman still on?
Oh, I just ended it, so.
What do you want?
The helpful resources.
So I'm like done.
Uh-huh.
If Beth wants me to speak on some other topics, I'd be glad to do that.
Oh, he's still here. Mark is still here if you wanted to. I thought it ended.